We have a rare opportunity to sit down and talk all things aesthetics with Dr. Strawford whilst catching him on a quick break. So, Dr. Strawford, tell me a little bit about yourself.
So, I'm an aesthetic doctor of over 15 years, and I'm the medical director of Skin Excellence Clinics now. I was a GP for the best part of 30 years. I was a partner in the Glastonbury surgery. So I've had quite a medical career. I'm happily married. I've got 3 children and a very busy life.
It would be interesting to know how and why you got into aesthetics.
It's quite an interesting story how I ended up in aesthetics. At the time, I was a full-time GP. I used to do quite a lot of minor surgery in my GP work. I was always very keen to use my hands. And I was also involved in running the Somerset out-of-hours GP service. And part of that job involved meetings down in Dorchester with the equivalent medical team from Dorset. And on that team, the medical advisor was a female doctor called Dr. Linda Eve. And she was, every time we had a meeting, which was every 3 or 4 months, I noticed that she seemed to be looking younger and more beautiful. And she let the cat out the bag and said that she'd started having some Botox treatments and some other aesthetic treatments, and that actually she'd trained to do them herself and was actually going to leave general practice and set up aesthetic practice as she found the work so rewarding and enjoyable. And she just suggested, knowing me, that I would be really interested in aesthetics, because she knew I liked to use my hands. So I was quite creative, and I was, I was not bored of general practice, but I was looking for a new challenge to run alongside my general practice in medicine. So it's down to that person, I think, how I entered this amazing world of aesthetic medicine, because truly I had no knowledge of it 15 years ago. And here I am now as a full-time aesthetic doctor. So that was my journey into this world.
Could you explain the core values that make a good aesthetic doctor?
So I think the core values that make a really good aesthetic doctor, I think the values that make a good doctor to start with, really, you have to be somebody who's a good listener. The basis of any medical treatment or any medical care stems from somebody who can sit down and listen, find out why that patient is sitting in front of you, what their concerns are, what their worries are, what their fears are, what their expectations are, what their motivations are, and really being able to listen to that and then reflect back on what that patient is telling you, to be able to offer them solutions that may help in lots of different ways. And that's the basic premise of a medical consultation. And I think a good doctor has to be willing to learn. They have to be open, always looking to improve and to widen their knowledge and experience. It's a lifetime of learning. And I think if you're willing to put yourself in that position, then I think you can practice whatever form of medicine, whether it's general practice, surgery, aesthetic medicine. It all has the same basis. I think it's the same core values that make a good aesthetic doctor. I think the other thing about a good aesthetic doctor is somebody who can see things in a 3-dimensional way. So we have to observe and examine and see things so that we can actually use our skills, our practical skills, especially when it comes to using things like dermal fillers and that, to actually use them in a very natural and appropriate way, because it's you have to have that creative side, and I think I do have that. I've in the past been interested in pottery and sculpture and stuff like that. So I think that all feeds into some of the skills of a good aesthetic doctor.
I noticed from your website and your profile that you're a key opinion leader in the aesthetics industry. Could you tell us what this really means?
Well, I think in medicine as a whole, it's a lifelong learning, and I've certainly in my aesthetic career I'm always wanting to learn more, find out more, and to broaden my experience and knowledge base and practical experience. And that has led on to, as a good doctor, me helping others on their journey of learning. So I'm in a position with my amount of experience and knowledge and wisdom, so to speak, that I can help other doctors and nurses and surgeons by imparting my experience, my knowledge. And that has led me opportunities to go and lecture, to run workshops, training workshops in this country and abroad. And I find it very, very stimulating as well, not only because you're working with other colleagues and giving back, but also that networking and learning from each other. I'm always being challenged. And I think it just keeps you at the head of the game, really. And it's very, very rewarding. And I think that's for me one of the real plus benefits of this industry and the opportunities that I've been lucky to have come in front of me.
So, Dr. Strawford, you do a lot in aesthetics, but you're also interested in well-being. Could you tell us a little bit about this and why you introduced it into Skin Excellence clinics?
Well, I'm actually very passionate about wellness and well-being, and that probably stems from my early days as a GP. And I was very much interested in the fact that I realised most of what was patients sitting in front of me were presenting with diseases, often degenerative diseases, which could have been prevented or slowed down if we look more at the health optimization and wellness medicine. And so I've been studying wellness medicine from a personal perspective for my own benefits and that of my family, as well as my patients, for many, many years. And it's always been part of my practice. So it's something I discussed from many years ago with my patients coming forward with aesthetics, because I think when we're doing aesthetics, if there's anything we can help from an internal point of view, from a wellness point of view, then that is going to influence not only the aging process that we see on the skin and face, for example, the hair, but also from how patients respond to treatments. And I've always been very interested in what is now called regenerative aesthetics, which is using the healing power of our bodies, using technologies or biotechnologies or even our own cellular mechanisms to try and improve health and well-being, as well as outcomes from aesthetics. So I've been involved in this arena for many years from the health and well-being. It's really interesting because this is becoming flavour of the month in the aesthetics industry, and a lot of people are now catching on to the fact that the health of the body influences how we appear, how our aging is happening, and people want to live longer, healthier lives without perhaps some of the degenerative diseases or signs of aging. And so there's a natural shift towards that. And I think you'll see that a lot of clinic practitioners are starting to catch on with this and are offering these sort of services alongside their aesthetics. So, yeah, I've been ahead of the game for some time with this, and I'm passionate about that.
I noticed from the treatments you offer at Skin Excellence clinics that they're usually sort of cutting edge treatments. Could you tell us a little bit about why you have that innovation of treatments and procedures that come into Skin Excellence?
So I've always been interested in the regenerative side of aesthetics, i.e., how can we improve things from a more natural, functional way? How can we slow down the aging process? How can we use technologies or cellular advances in actually, getting those outcomes we want? We want nice, natural, we want safe and effective treatment passages. So it was always more than just a bit of Botox and filler in my clinics. And I've always been searching out and going to conferences around the world and researching the web to find out what is happening. It's a fast-paced industry, and these things are being developed at all. Every day there's something new coming out, and I think I've always been at the front of going out and listening, looking for these things. And then if I find something that seems to have relevance and is very safe and effective, I will consider introducing that into my clinic and into my practices. So we're often, a classic example is polynucleotides. I came across these more than 2 years ago, before anybody was really talking about them. And then they were first released in the UK, and I was one of the first doctors to use polynucleotides. as I was one of the first doctors to use collagen-stimulating fillers such as Sculptra and Elanze. That's always for me. I want to try and find the most effective and safe treatments for my patients, and always have a big array of treatments that we can offer people. It's a bit like going to a pharmacy, and the pharmacy is stocked with all of the medicines and pharmaceuticals that you could think of, rather than just one or two.
Your Skin Excellence clinics are CQC regulated, which is Care Quality Commission regulated. Why did you introduce that to your clinics, and what does this mean to you and the general public?
Well, I truly believe, and I'm passionate about this, that aesthetics is a medical speciality. We're often treating patients for diseases, skin diseases, or even for psychological, emotional reasons they're having treatment. And that involves a proper medical consultation in all cases. And then the delivery of a lot of our treatments, some of which can be quite invasive, putting a needle in somebody, using a filler or a medicine like Botox, or some of our energy-based treatments. These can be quite, there are benefits and risks associated with any of these treatments, so they can't be taken lightly. And I think these treatments, as all medical treatments should be conducted in an appropriate setting. You wouldn't expect to go to a hospital and have expect a certain level of facilities, same as in your GP practice or your dentist, to provide those services, which need to be safe. As a doctor, we need to. The Hippocratic Oath says we do no harm, so we must always have our patients at the forefront, doing things that are going to hopefully help them, but definitely don't do any harm. And that's why I believe this is medicine. And unfortunately, in the UK, where it's an unregulated industry, there is a lot of harm going on out there, increasingly so, because this is not regulated. And I think being part, the procedures that we do are medical and surgical procedures. So they, by law, have to be regulated as a doctor by the Care Quality Commission.
So Dr. Strawford, tell us what your favourite treatment is and why.
Sure, that's a hard one to say what's my favourite treatment, but I think the one that gives me the biggest buzz is when I have the opportunity to do a full face rejuvenation. So this is where I can address all of the aging aspects of the face and often the neck, and using treatments such as Elanze or dermal fillers, often in combination with botulinum toxin and some of our energy-based treatments to rejuvenate the skin, or maybe even lifting with threads. And that's what I call a full face rejuvenation. So we can restore and reverse in a natural, harmonious way, keeping the balance and the profile of a patient's face. And that's really important, because I think without that, just treating one area in isolation or just focusing on one thing or another, we can often distort people's faces, make them look unnatural, unreal. Perhaps even it's termed alienization. So there's a lot of people, and I think a lot of my patients are fearful of that, and they don't want to end up like that. They see those people out there on the streets. So I think, the full face rejuvenation for me, working with somebody to achieve that ultimate outcome and seeing how that changes people's lives in a positive way, is what really gives me a buzz.
There can be a lot of negative press around aesthetics. What don't you like about the aesthetics world?
I think there is a lot of negative press in the aesthetics world, and I think that's because, unfortunately, it's an unregulated industry, and there are a lot of unethical and unsafe practices out there, and I think the way that a lot of that is being driven by social media as well is the thing I'd really dislike, is that there is a lot of fake images, a lot of fake claims. You can be a specialist without any training or qualifications, advertising your services and providing inferior and often unsafe services, and yet you can get away with it. It really is the Wild West. And I think it's very hard for professionals like myself with regulated clinics and the time, effort and money that goes into that to compete with these cowboys effectively that are out there. And I think we need to, then something needs to be done about that sooner rather than later before more and more harm is done.
Tell us a little bit about body dysmorphia, how this presents, and your decisions whether to treat a patient or not that you diagnose as having body dysmorphia.
Body dysmorphia is very interesting because it's not that uncommon. Okay, it is a psychological or even it's a psychiatric disorder, and it's a disorder where somebody sees some imperfection in themselves, which is out of kilter or out of proportion to the reality of what is going on. And they seek treatment to correct something. But it often becomes often these people have an addictive personality as well, because they get a very short-term gain from a treatment. And they will be then looking for the next treatment and the next treatment. And they really don't see what the rest of us see when they look in the mirror. So in a way, it's a bit like an anorexic who feels they're overweight when everybody else can say that they're desperately thin. They don't see these imperfections. They see the imperfections that we don't see. And even when we correct them, and they're never happy. They want more. And really, this is a condition that is not best treated by having treatment, but it's best treated by having psychological therapies and even medication to correct the psychiatric problems. And I think, unfortunately, we need to find these people and screen them out and help them in that way or point them in that direction, because actually treating them is not in their best interests. Very different from the vast majority of the people that come and have treatment, where there may be some psychological or emotional reason for treatment because they may be feeling low or less confident about their appearance because of how the aging process has affected them, or maybe they have a genuine cosmetic defect like an abnormal shaped nose or whatever. And those patients, the motivation for treatment is to feel better about how they appear and how they feel in themselves, and that's usually the outcome of treatment if we can do it well. And so we have to be very careful there to screen the patients out who do have BDD or body dysmorphic disorder.
So Dr. Strawford, tell us a little bit about your team and how important they are in delivering such a unique service to your patients.
Well, look, for many years I provided a practice in aesthetics, which was basically just me doing everything, even booking patients in and communicating with patients. But, clearly, that's difficult to sustain a certain level of service as you get busier and busier. And actually, the team is really, really important. It's what I call multidisciplinary care. So I've come from that background in my general practice. The service we provided was based on a mixture of professionals and support people within a team. And actually, the success of Skin Excellence clinics, I hate to say it, comes down not because I'm seen as an expert injector and I can deliver the treatments that patients want, but actually it's the team around that support me. And that is what's made Skin Excellence clinics go from success to success. And we're busier than ever. And it's great that I have other colleagues and team members who can support me in delivering some of those services in terms of treatments as well. And it's very important.
So in a few words, what would you like your patients to say about you?
I would hope that my patients go away and say, he was a nice bloke, he listened to me, and he's very skilled, and I'm really happy with what he does. And I'm not going to go anywhere else if I'm going to have any treatments in the future.
You're obviously a very incredibly busy person. What do you do to relax?
Well, yeah, I live life to the full. So I am very busy, and I do still enjoy every day coming to work. I get a real buzz out of working with patients and delivering these treatments and seeing and getting the feedback from my patients at the end of the day. Switching off, I think I've always been a bit of a high octane, high adrenaline junkie. So a lot of my spare time involves either chucking myself down mountains on bikes or skis, or being dragged along behind boats, or being pulled along by a sail. So usually some sort of activity is involved in my spare time, but I'm learning to try and slow down a bit.
What is the most rewarding part of the patient journey?
Well, that's a hard question. To what is the most rewarding part for me personally? I think the patient journey is crucial, and actually it starts from the point when the patient picks up the phone or sends that first email, and the response that they get from that. But it is a journey, and I think from my perspective, probably the most important part of that journey is their first ever consultation with me, because that's when I really can identify what their concerns are, what their drivers are, why they're coming, why they're sat in front of me, and what they think I can help them with, and what that's going to mean for them at the end of the day, how they're going to feel or be afterwards. And I think that initial hour that we have with patients, for me, is the most crucial. And in most cases, that usually leads on to me being their doctor, or them coming to Skin Excellence clinics for many, many years. And I do have a very loyal fan base, so to speak, or bunch of patients that I've known, some of them now for over 15 years. And so I think that's the reward for me, is that initial journey, and then keeping in contact with them, being able to provide them with that as we all grow a bit older together.
So aesthetics is forever changing. What do you see as the future of aesthetics?
Aesthetics is rapidly changing, and in the 15 odd years or so that I've been involved, I've seen huge changes, and I'm glad to say that I have, on the whole, pretty much kept up with all of those changes. But I see things changing in regards to what would be classed as molecular biology. It's actually utilizing the incredible powers we have within our own bodies, utilizing things like stem cells and exosomes and all of these things that come from healthy living tissues, and actually using those to influence processes at a cellular level, protecting DNA. So I think, and we're going to be using much more genetics. So we're actually, gene therapy or gene testing is becoming much more available, and we're starting to use those in our clinics, where we can actually look at what's broken within your body at a cellular level, what's going to work, what can fix that, what supplements will work, what medicines will work, what won't work, even when it will come down to a skincare regime, which will be dependent on genetic testing and cellular mechanisms that we've identified in your body. So I think it is truly, bespoke medicine that we're heading towards. And I think that's fascinating, really. And I think who knows what we'll be doing in another 15 years' time. I think technology, artificial intelligence, AI, is going to play a huge part in that. But yeah, it's exciting. It's exciting just to see how it's developing. It's so fast.
Thank you.